7:14 on this October 20th. I want to welcome to microphone number 2, Dr. Charles Osgood.
Beautiful weather. I can't believe how warm it is in October.
It's something. It's nice.
Really,
hey, I like
really
your new
nice.
technique for adjusting necks.
Yeah?
Sit here in the Corvette, hang on tight.
Yeah, that's fun. You know, when my dad was young, he had a brother that had a Corvette.
What year was his?
64 or something like that, you know. And he said he took it for a ride one time and put a $100 bill on the dashboard. And he said, if you can grab that $100 bill, it's yours. And he couldn't.
He grabbed it to the floor, didn't he?
Yeah, he couldn't. So, yeah, I'll tell you what, that can be kind of fun when you're in a nice fast car. It's kind of cool. So
Fun.
yeah.
So what's going on?
Well, you know, we're talking about necks, but also a lot of folks have shoulder issues.
Yeah.
And don't really know that chiropractic care can help shoulders. There's just
really?
about any joint in the body can be helped with chiropractic care. I work on people's elbows, wrists, you know, forearms, you know, that the muscles of the forearms can actually give you symptoms of carpal tunnel syndrome. And so we can work on the muscles around the forearms along with the elbow joint, wrist.
So what happens in the shoulder?
The shoulder can, you know, from overuse, like, you know, using too much of the mouse or having to sit at a desk a lot, you know.
What about a carpenter where he's using electric hand tools?
If you're doing a lot of repetitive motion, what tends to happen is the shoulder joint itself can get locked up and stuck.
Really?
Which we can adjust that. We can adjust that. But the biggest thing that happens is that you get across the back, the muscles in the back. There's some muscles that go between the shoulder blade and the spine. They're called the rhomboid muscles. They can get scar tissue built up, knots build up in those muscles, and then they pull the vertebrae in that area out of alignment. And so you end up with this pain right between the shoulder blades, right along the spine, between the shoulder blades. Plus, if it gets bad enough, it causes nerve entrapment in the nerve that runs down the arm, and you can get pain down the arm. You can get numbness and tingling down the arm. All of that can occur just because of you've been working it too hard. And it usually occurs over a few years of doing something like that, a lot of repetitive motion type things. But yeah, it's something we work with a lot there in the office.
Wow, I had no idea, but I see the point.
And it can flare up on people this time of year too, with the raking that you're doing, and you know, getting up and getting the leaves out of the gutters, and you know, that kind of thing. But overuse is the biggest problem with that, and it can be pretty debilitating for some people. Actually, we get some people in the office where they can't even. It gets so bad, the muscles spasm so tight that they can't turn their neck, and they get to where things just don't function with the shoulders and the neck and all that. So that's kind of how it works. You know, when it's like that, it gets that bad, you can't even function. There's something we can do with it. You don't have to just live with it and pop pills all the time. It's not something that's going to go away on its own.
Wow, I had no idea.
Yeah.
You know.
What we'll do is we'll take pictures of the neck and upper back. We'll see how the bone structures look. We'll see how the disc structure looks. We'll see what the alignment looks of that whole area, and how the neck and the upper back are contributing to the nerve problems, which are causing the muscles to spasm and tighten up and pull everything out of alignment. So,
you know, when you were talking, I can remember what they used to call growing pains.
Yeah.
And I remember you used to get this sharp pain kind of underneath the shoulder blade.
Yeah.
And like a pinch nerve, like you turn one way, it takes your breath away.
Those are actually from ribs that get misaligned.
Really?
Yeah. When it takes your breath away and you take a deep breath and you're like, oh, this searing pain, you know, right in my chest all the way to the back, that's typically a rib that's misaligned or gotten out of place. That can be aligned as well. That can be adjusted. So I get those a lot too. I get folks who have been to the emergency room because they think they were having a heart attack because the rib pain is so bad. It goes all the way through, it sears all the way through to the back. And they think it's a heart attack, and it's not. And we adjust that rib, and they're like, they get off the table, and they're like, oh, wow. And I can take a deep breath, and it's working now. So it's...
Wow,
it's
so the pain can be similar to that of a
heart attack. A lot of times.
That's amazing. That is amazing.
There's so many little intricate things that can happen with the muscles and the nerves in that area that that just by adjusting them and relieving that nerve pressure, you can get great relief. And in fact, usually it's right away. So,
okay, hypothetical situation.
Yeah.
Let's say that there's somebody my age or a little bit older. I'm 57. Let's say they're 63 years old. And good health, but let's say that one of the light bulbs is out in the ceiling fan, and they stand on a little stool, and they reach up and that shoulder pops.
Oh, yeah, yeah. Well, popping in the shoulder, or it can get locked up, where you reach up and then you can't raise it high enough. Mm-hmm. There's things that's called like frozen shoulder, where you try to reach that shoulder up and you can't move it up high. And that's typically from old injuries that have created scar tissue, and now it gets to where that shoulder is so bound up that you can't move it. And there again, it can be worked with. I've had several who've had frozen shoulder type problems. Now it takes a few more weeks to kind of get that back under control because it's really stuck. But by using things like ultrasound and massage and adjusting the actual shoulder joint itself, and by doing that several times, we can actually get the person who, can only raise their shoulder a little bit to where they can raise it now over their head.
Yeah. Wow.
And, there's a lot of folks that just live with it. Oh, I can't raise my shoulder. Well, you should be able to. That's a problem. Let's see if we can fix it. And usually there's a lot we can do with those type of problems, too. A lot of stuff that happens with that shoulder joint. There's a lot of intricate things going on because it's kind of a weird joint anyway.
Well, I started sitting here thinking, trying to think, I can only pull it back so far. Mm-hmm. And I don't know, that's weird.
Yeah.
I didn't know the shoulder joint could be adjusted.
Yeah. Yeah, there's the ball and socket joint in there, and it can actually get misaligned a little bit. And then the shoulder blade itself is part of that joint and allows it to move even more, but the muscles, when they get bound up and they get tight, they restrict that movement. And a lot of times you've got to untie the knots in the muscles with ultrasound therapy, massage therapy. We use deep tissue massage. We've got a great massage therapist. And by using all of those techniques together, we'll be able to attack those problems and get you back on, solid ground again, where you can actually move that shoulder, and you don't have restricted motion, and you're not just putting up with it and popping pills because it's hurting all the time.
I'm pulling up a picture of the human skeleton here in the computer.
Oh, yeah.
And okay, so the shoulder kind of interlocks here with what's at the sternum?
Well, you've got a bone, the collarbone that comes over.
Yeah.
And it hooks to the sternum. So the collarbone goes...
I see that.
Collarbone goes over, and then it hooks to the shoulder joint itself.
Yeah.
And then you've got this, shoulder blade in the back that kind of floats on top of the ribs back there. It's kind of a floating joint back there, and the only thing holding it to the skeleton are muscles that hold it to the ribs and the rib cage area.
Oh, I see that. Yeah.
So that actually is, the shoulder blade itself is a big part of your movement. You should be able to, it actually, when you raise your arm up, the whole shoulder blade moves up, and that allows you to move that arm up and get it up high.
Wow. I had no idea that joint could be adjusted. Wow.
Yeah. There's so many little things in there that, moving parts that if they stop moving correctly, you're going to have a lot of range of motion problems, and we can correct those things. It's something that you don't, like I said, you don't have to just put up with it.
So, if I'm seeing this correctly, just by helping the shoulder pain, that can alleviate a lot of, I don't want to say tension, but a lot of pressure on the lower neck,
sure,
upper back.
Yeah, because the muscles from the neck go out to the shoulder. Okay, and so a lot of times when you get misalignments of the neck and problems with the neck, it'll draw those muscles up and draw that shoulder up. It'll get to where you can't turn that neck like you're supposed to be able to.
Wow.
Yeah.
Wow. That is cool.
Yeah, so, go to our website, mountainhomechiro.com, and you'll be able to see there's things about shoulders, there's things about hips, there's, subluxations, which are misalignments of the vertebrae, all kinds of good, tips and techniques about what chiropractic does. We also have a blog there where each week we'll discuss a different topic and talk about things that chiropractic can do to help, But you can also sign up to be a practice member where you get a newsletter, and each month we send you an email newsletter about what's going on and what chiropractic can do and those type of things too. But if you just have a question and you don't necessarily want to come into the office, to talk, but you just say, hey, I'm not sure if you can help me with this, can you? Send me an email, because there's a link on the website to just send me an email, and it goes directly to my inbox. And I'm the only one who sees it. Ask me whatever question you want, and we'll see if it's something that we can help with or not.
Wow. Man, I had no idea of the shoulder, but when I was looking at that human skeleton, I can see exactly what you're talking about right there.
Yeah. And all of those joints where there's a joint, like the collarbone has joints. Those get stuck sometimes where they meet the sternum, where they meet the shoulder itself. I've actually been able to adjust those joints and get those moving better too.
So, here's the whole point. And, well, I'm just going to say what I'm thinking.
Yeah.
A regular chiropractic regimen will keep you kind of floating in the air.
Yeah, it'll keep everything moving.
I mean, yeah.
It keeps everything moving like it should, and you don't get locked up and bound up. And that's really what maintenance or wellness care is all about. Once a person typically comes in, they start coming in because they have an issue. They keep coming in on a regular basis because it just keeps moving good.
Yeah.
And they feel good every time they're adjusted. And, we have a lot of folks who come in for maintenance every couple of weeks or so, and they find that they don't get the colds and flus that normal people, will get. Their immune system functions better.
Yeah.
Every time you're adjusted, your immune system actually is boosted by about 50%. Yeah.
That's good.
So, it works really, really well just for an overall, hey, keep you feeling good and keep you in good shape. So,
wow.
There you go.
I'll tell you what, Doc Osgood's helped me many, many times and continue to. Every so often come in and have to get readjusted.
Oh, yeah.
Yeah, I'm at the point now where once a month, once every 6, and it feels good. And I'm due,
Right. And if you do that, if you continue that, then that just keeps you in so much better shape. And that way you don't wait until you're really hurting, and then when you wait till that point, then it's almost like rescue time. We've got to do several visits in order to get you back in shape again. So it's almost like starting from scratch if we've got to do that over again. But if you stay under care and you stay in good shape, then you don't have to worry about it.
Well, how about your location and your phone number?
We're right across the street from Affordable Insurance and Centennial Bank, right up the street from here.
And we'll see the sun. Well, in the wintertime, we can see the sun. The leaves are off the trees.
That's right. And it's 425-4424 is the phone number. Give us a call. There's a lot we can do for those shoulders. If you're just suffering with them and not sure what you can do to get help, there's a lot we can do to make those
If you're suffering
function.
from joint pain and taking pain pill after pain pill, stop in, make an appointment with Dr. Charles Osgood and talk with him.
And even if you've been told it's arthritis and there's nothing you can do, that's not true. There's a lot we can do, especially with arthritis.
Yeah.
Because arthritis is nothing more than a worn joint, and if we can make that joint function better, we'll be able to help the arthritis pain.
Check out the website, www.mountainhomechiro, Chiro, mountainhomechiro.com. You can talk to Doc through the email, the blog, and anything else, or call the phone number at 870-425-4424.
There you go.
All right.
Don't just live with it.
Don't live with pain. Get it fixed.
That's right.
Now, I guarantee you, Doc Osgood helps me all the time, and it works. Don't believe me? Stop by, and I'll tell you face to face. Anyway, that brings us up to news time. Back right after this. 7:35 on this beautiful October 20th. I want to welcome now to microphone number 4, Dr. Derrick Johnson of Integrated Dentistry. Welcome.
Hey, good morning, Dale. Good morning.
He's eating a donut.
Yay.
Got these donuts, coffees down
Donuts
here.
are
Oh,
awesome,
they look
man.
good. I'm
Donuts
going
are
to have to indulge. I haven't had a donut in a long time.
I got patients that bring them to me, and they call them fat pills.
Do they work?
Oh, yeah. They do.
Now I have to bring we have to bring Jack Clayton and Ruth Ann Clayton in and talk about proper nutrition.
Yeah, there you go.
As well.
See, I only took a bite, bite.
Just a bite.
Okay.
Yeah.
Of course, got floss after this.
There you
Yeah, there you go. Brush those teeth.
So how you been, Doctor?
Hey, I've been great. Been having a busy summer but really good. Really good.
I'm going through the website here. What do we need to talk about today? What do you need to bring to our
Today
attention?
today is the update on. We started last year was the first year we did a program called Project Smiling Again.
I remember.
And that was, we had people nominate veterans that were in need of dental care and weren't in a position to get done what they needed to get done. So we had a really good response last year. I brought a few photographs here
that's cool.
of cases. We actually selected 2 people last year. The objective was 1, but we had. So this was one gentleman here.
Yeah.
Danny.
Oh, yeah.
And
Yeah.
another patient of ours was Linda, who Linda is almost done. We did quite a bit of work on her as far as we did multiple implants, and these are actually her temporaries, but she's almost done, but she's coming a long way.
That's awesome.
Wow.
So
Unbelievable.
my purpose here is just to let people know that we're in the 2nd year of this, and we're now accepting nominations. So if they know a veteran in need of something like this, that they can nominate them. And what we do is we're taking nominations, and basically the nomination would be a basic summary or story of this person, their service, their particular life situation now, and why they feel they would be a good candidate for this.
Huh.
And then from there, we'll have veterans come in for a screening, and we'll make a selection on Veterans Day.
That's cool.
That is neat.
So are you doing like false teeth for them, or are you doing what kind of teeth do you put in?
It really depends on what they need.
Okay.
And that's our thing is when we
It's a
find
personal thing.
find the right person, whatever it is they need. I mean, in this
Yeah.
case, this was a multiple dental implant case. Everything was fixed.
Yeah.
She doesn't take anything in and out.
Okay.
This was a more complicated case than the other one. But we got her smile looking great with provisionals, right away.
Those are great looking teeth.
And then we're going to come back and finish this in the next month. So hers was about a year-long process. This process here, he had already had some existing dentures.
Yeah.
And we went back and we did put dental implants in and set the teeth where they needed to be. And now he has implant-supported dentures, which, implants is like a miracle for dentures.
So
denture
an
wearers.
implant is like a tooth that's grounded. You don't pull it out.
Yeah, exactly. So a dental implant is a titanium screw that goes into the jaw, and it acts just like a tooth root would act.
Oh, wow. Cool.
But you can do, this was a good case of showing you can do multiple things with implants. So here, we put in like 4 implants down below, and that stabilizes that lower denture. So anybody who wears dentures knows lower dentures are really unstable and can be very difficult. With implants, it's like night and day. They snap in place. They don't move. It increases your chewing power.
Cool.
And then when you put in the implants, the bone stops resorbing. So when someone loses their teeth, they lose bone.
Oh, wow.
When you put implants in, it actually stabilizes the bone.
Oh,
It stimulates the bone.
Yeah.
And then, like I said, this case here, where she had some good teeth, and we just put implants in the missing areas, and then she's going to have just like normal crowns that go on those implants. So implants are very versatile. You can do a lot of things with them.
That's amazing.
Yeah, I would think I would rather have implants than dentures any day. I mean, is that what we're moving to now, is more implants than dentures?
Yeah, absolutely.
Yeah.
Just because, I mean, if you just measure biting force, I mean, if somebody has implants versus somebody has dentures, you can imagine a denture, you're just pushing against your gums. When you have dental implants, I mean, you have something solid to bite against.
Yeah.
So
That's pretty cool.
Yeah.
It sounds like the dental implant is almost like having your real teeth
It's like
back.
having your teeth
yeah,
back.
exactly. And that's how people describe
Do
it.
they feel
too.
more natural?
Yeah, absolutely. And just psychologically, it's huge
Yeah.
because just the increased confidence. And then if we can do a case like this where you don't have to take anything in and out, I mean, it feels like you got your natural teeth back.
That's awesome.
Yeah.
That is really awesome. I mean, I didn't really know that was the case.
Yeah.
Really.
So nominating a veteran or veterans for the Smiling Again program.
Correct.
And you'll choose the winner on November 11th?
That's right. That's right.
Well, that's coming up quick.
Yeah, it is. It is.
22 days away.
Yeah, and I think on our website there is, so if you're on the homepage of integrateddentistry.com, there should be a red, white, and blue banner on the homepage.
Okay. Homepage?
Yeah.
Okay, home. Oh. Speedy here keeps jumping around here. Okay, homepage. 7 years ago. Here we go. Okay, there's the homepage.
Let's see, maybe not. Sorry about that.
We'll look. We'll
let's
look.
see, scroll down again.
Yeah.
It's got to be there somewhere.
Oh, you know what?
Dental implants right there.
No, if you could go to integrateddentistry.com. I think you're on a website called smilingagain.com, which is another website of
Well,
ours.
I thought it was integrated. Yeah.
Yeah. Yeah, we're in the process of building a. See if that gets us there.
Well, let's see. What keeps going there?
So
You
on
want to
the
type it in directly.
yeah
Yep,
on that
you-
homepage is a
We'll find it
a
there.
banner. It should be pretty obvious. It's a red, white, and blue flag banner that says Project Smiling Again, and that'll give details. And you can call our office, and my staff is very familiar with the program, so they can help you out.
And you can click on that banner and nominate someone.
Yeah.
Okay.
You click on the banner. That'll give you directions as far as nominating someone, and you're welcome to call. If you don't want to do it online, just call and talk to somebody directly.
That's cool.
That's got to be such a self-esteem booster.
Yeah.
When you're self-conscious about your appearance.
Yeah, well, you see with people who have teeth like that, they're not smiling. That's why you're saying smiling, and
Yeah.
nobody's smiling when they're holding their teeth and they're just not smiling.
Yeah, and it takes a lot of effort and energy to do that.
Yeah.
And it was especially, I mean, the Linda, because she was so active in the veteran community anyway.
I think
And
she's
it's
been on
really
the show.
bolstered her
Self-confidence.
activity and the amount of things she's doing now. So
Sure.
there we go. There's integrated dentistry. So scroll down a little bit, and I believe you're going to see that banner there. And
Come on, Speedy.
there
we
you go. So
yeah.
see it on the right side there. It says View Our Project Smiling Again.
Yep.
So people should go to integrateddentistry.com?
Yeah.
That's the one.
Cool.
There it goes. There we go. I think we got it now. Speedy's a good computer here, but he gets a little bit slow. There we go. Time to reboot this dude. Oh, there you are on XL7.
Yep.
Is that a...
Yeah, we did that. That was we did a follow up with Linda. So
That looks like Dan Reynolds right there.
that could be.
Cool. So, we can nominate a veteran for that.
That's a good idea.
Who needs a new
Who
smile?
needs a new smile?
We'll have to do some thinking.
Yeah, there you go. I'm sure there's a lot of folks out there who could use it.
What about just, I know we're talking about veterans and who deserves it more, but everyday folks just want a new smile. They say, I'm tired of how I look, blah, blah, blah. My teeth aren't the way they need to be.
Yeah, I mean, there's more options today than there's ever been. From things that are, I mean, really simple, basic things to, we solve really complex dental problems, but also just basic things that can be done. I mean, to get the mouth healthier and looking better, and it affects what I find when somebody goes through this process of just getting their mouth healthy. the mouth is such a central part of someone's, who they are. And it really has a ripple effect on their health. And we know that scientifically now. There's so many health-related problems that a person's at higher risk for when they have some type of dental disease, cardiovascular disease, diabetes. All these things are related to oral health. And then the other thing, just a psychological effect or confidence boost. So in a lot of different ways, it really can change somebody's quality of life. So that's been, that's why I love what I do.
Quality of life,
Yeah.
And that it's amazing, because Bob Zador talks about quality of life, and because men like you, got chiropractic care, got dental care here with Dr. Derrick Johnson, and you're here to help improve our quality of life.
Exactly.
Yeah. Wow. Why don't we grab a quick break? Go ahead and take this commercial break. Visiting with Dr. Derrick Johnson and Dr. Charles Osgood. Stick around. Be right back. 7:49.
Cool. So we were just talking about changing the upper palate and changing the way your face looks, and there's some new things that can do that too.
Yeah. It's really, this is kind of some cutting edge stuff happening in dentistry. But bottom line is, we've known for a long time that the mouth, closely related to the airway, snoring, sleep apnea, those types of things. But there's actually some technology now that can correct it long term, like not just wear an appliance that improves it, but actually structurally change things. So the airway, you're getting air at night, you're not snoring. So it's really a long-term fix for sleep apnea and snoring. So that's
amazing.
Yeah, that is cool. Yeah, and like I say, if it's not, you don't have to wear a bunch of braces or anything. If it's just something you pop in at night, and then slowly it pushes the top palate around. That's kind of cool.
Right. So it's the type of thing the appliance works immediately from day one when you start using it, but it changes the shape and form of the airway over time, and the treatment usually takes about 18 months. Yeah. But it's a simple appliance therapy.
Yeah, I've got a question. Both of you medical professionals here. Back, 40 years ago, maybe longer than that, 42 years ago, I wore braces. I was in high school. After they came off, I could tell that my tongue placement for certain words was different. Do you have to go with a little speech therapy to try to...
Yeah, this is, you bring that up. This is exactly, spot on with what I'm talking about here. Sure. With this is those functional spaces, the tongue and room for the tongue directly affects how you breathe, how you speak, your airway. And that's one of the things, like when we go through this process, if somebody comes to me with this type of issue, those are the things that we're looking at, is all those functional spaces. What is the upper airway look like? What is the tongue, how much tongue space? What's the tongue doing at night? Is it falling back, and is that causing snoring? And so all of those spaces, and this therapy can actually change that. And what we're trying to do is just gain more space, and we can do that because we found that the maxillary bone is actually adaptable. It can adapt and change and keep growing and developing even in adulthood. And you make just some minor changes in the shape of the palate has major effects with the airway. And you can imagine, like, if you're drinking through a straw, like a really tiny cocktail straw, and then all of a sudden you switch to like a McDonald's straw.
Shake straw?
Yeah, or shake straw, exactly. It's like a huge difference. And you do that with your airway, you just create a little bit more opening.
Oh, yeah.
And the volume of air that you get's totally different.
Yeah, that's awesome. Yeah. If you can move that top palate around, we were discussing this because I have that issue. I've got this crossbite, and there's a smaller, narrower top palate for me. So if you can do that with just an appliance wearing at night, shoot, man, I'm gonna come see you.
Yeah,
that's awesome. Just the snore factor alone would be awesome too. Because the family has trouble sleeping at night.
Exactly. Yeah.
Do you snore the paint off the wall?
I guess so.
Yeah, and then the amount of energy too, like you have during the day,
right?
Like when you're getting disrupted at night with sleep, or you're not getting complete oxygen.
Sure.
It's going to affect how you feel during the day, big time.
Definitely, yeah. I could see that.
Well, I got a question for both you medical professionals. How do you see, your particular line of medical treatment as compared to, say, 40 years ago.
Yeah.
The evolution of your treatment, and see, you understand what I'm trying to say? Because Dr. Johnson's got a book right here, and he's studying on some new techniques. I'm sure you've got continuing ed all the time.
Yeah, there's always something that's changing. You know, the cool thing about chiropractic is the adjusting really doesn't change that much. I mean, we're adjusting bones, and so we're making those little changes. But what we do find is that, you know, certain advances that we find with the muscles and with, you know, what they find out about the tissues and, you know, the fascias that hold the muscles together, that they can be manipulated and things can change that way. Those kind of things are a little bit, you know, more cutting edge, you know, because we find out more and more about those things as the years go by. And so there's more and more techniques that can be used along with massage therapy, ultrasound therapy, those type of things that will help with those aspects of it. The bones themselves, adjusting is adjusting, and if you have a good adjusting technique, you're going to be able to adjust the bones. But if you can address those other aspects, your adjustments will last longer, you'll hold longer, and those type of things too. So.
And Dr. Johnson, your line of work there, you know, advancing.
Yeah, I think the main thing that's happening with dentistry, it's becoming more. So I call my office integrated dentistry.
Yeah.
And the reason is it's things are going in that direction where it's no longer about just fixing a tooth, but how is this tooth affecting? How is it involved in the entire arch, and what's the gums role, and how does this whole thing fit together? Because these teeth, they tie into your jaw joint, which ties into all the major muscles of your head, and there's all these health implications with when somebody's mouth is diseased.
Sure.
It affects all these areas in the body. So I think this idea of looking at a bigger picture, and the bigger picture that you can look at, I think the more successful your treatment outcomes can be.
Oh yeah, so. I bet.
Dr. Johnson, your phone number and location.
Phone number is 870, obviously, 580-0950. And we're at 114 Dyer Street, and that's basically where 5 and 62 meet there at Bradford Square, and we're on the side of that building on Dyer Street.
Yeah.
Okay.
Cool.
Doc Osgood.
425-4424. Don't just put up with, you know, pain and aching and soreness all the time. Something wrong, so you need to fix it.
Chiropractic has been amazing for me.
Oh, yeah?
Yeah. And I think, I mean, the way I see it, it's like the body's kind of like an electrical system. Like everything needs to be wired right.
You
and when your
function.
spine is kind of got a kink in the hose, or with the spine, it needs to be straightened out. And when that happens, it's good things happen. So.
Definitely.
That brings us to the close of the show. Thanks to Dr. Derrick Johnson, Dr. Charles Osgood. We'll be back tomorrow. Hope everyone has a great day. Remember, try not to burn outside. Very, very dry. I don't know if there's a burn ban yet.
Don't burn inside either.
Don't burn inside. We'll be back tomorrow. Bye-bye.